Wonderful. All right. Good morning. It's really good to see all of you today. I'm Jen Lewis Walden, and I use they, them, she, her pronouns, and I sit on the leadership team of Shift Health Accelerator. I'm excited to facilitate our conversation today, specifically that will focus on community agency and decision making and the role that public health leaders can play in democratizing community-led change in resourcing strategies in an effort to accelerate health equity efforts. We'll be diving into the concept of participatory funding today with colleagues. That enable community voices to drive investment decisions into the community conditions that create health. We'll also explore the role that public health and multi-sector coalitions play together in enabling community-led participatory funding. I'm joined today by three amazing colleagues. I have Sonia Sarkar and Lisa Richardson from Shift Health Accelerator, and Anita Kumar from the Bay Area Health Inequities Initiative, or BARHA. All of us are doing work in spaces that surface insights around participatory funding that help audiences and practitioners like public health leaders think about their unique roles in accelerating health equity efforts in jurisdictions that you're working, and to enable partnerships that are actualizing commitments to health equity. We'll hear about Shift's work to test community governance of grants and investment capital, where community residents are playing a lead in decision making. And we'll hear about BARHA's recent community of practice that supported public health leaders in their strategic role in multi-sector coalitions and bringing in community voices to drive decisions around strategy and around positioning coalitions as an investment platform for health equity efforts. We'll aim to explore power sharing in the ways that public health can continue to democratize equity commitments and what it might open up in terms of possibilities for your work. So with that, I'm going to turn it over to my colleague Anita to share a bit more about her work with BARHI and some of their most recent insights.
Thank you, Jen. And thank you for this opportunity to be in conversation with the Shift team. I'm really excited for this conversation. I think we're all doing really incredible, very important work, especially in this moment. So I'm going to share my screen. Here we go. And everyone, does that got that? Okay. I'm going to share a little bit just about the community of practice that we ran last year. In partnership with Shift and with Jen. Thank you, Jen, for your incredible thought leadership on running this program. But last year, Barhai, we piloted a community of practice for public health leaders and public health departments across the country. It was called Transforming Community Coalitions to Unlock Upstream Investments in Health. It was a 3-month program that brought together 25 public health leaders from 5 counties across California and Nevada. And the goal was to shift, like what Jen was saying, public health practices to support community-driven, multi-sector coalitions and to help them deepen their capacity for upstream investments in health equity. It offered tools, connections, practice space with colleagues to explore how to solve these very complex implementation challenges and scale up promising practices within their local context. So a little bit first about Barhai. Barhai was founded as the coalition of the 11 Bay Area's governmental public health departments, specifically to work on the issues that impact health outside the doctor's office. At Barhai, we often hear public health leaders, we're in conversations with many public health leaders who are seeking guidance on how to implement this framework, right? How can they shift their internal and external practices such that community is driving the priorities and shaping decisions to address health inequities? We also hear often that for them, the some of the biggest pain points are the current funding structures, as well as the siloed planning efforts. And so this community of practice was an opportunity to start addressing some of those pain points, specifically focused around the living conditions, right? The neighborhood conditions, like the physical environment, the social environment, housing, land use, transportation, in essence, place. It The community practice delved into three core themes. The first being community leadership and shared decision making. How might coalitions implement, or what are a range of strategies for building community leadership within the collaborative's governance structure? The second was around aligning public health planning processes, specifically the chip and the chaw with how do you align the chip and the chaw with the coalition's strategic priorities, and how this could form the basis for the coalition's investment platform. And then finally, this term community investment. This is a really broad term. People come from it from many different lenses. So in a minute, I'm going to share the definition we provided specifically for this community of practice. But I just wanted to highlight the North Star for this community of practice was really when you're putting all three of these core themes into practice, the North Star line of sight for coalitions is really that community-driven multi-sector collaboratives have deepened capacity for upstream investments in health equity. So what is community investment? A little bit about how we defined it for the purposes of this community of practice. What we shared with the group was community investment are the priorities local community has identified that focus on the assets with long-term value. Things like housing, community facilities, commercial space, the built environment. And the finance structure for upstream investment is different because they require repayment and they require accrue value over time, right? So grants typically pay for programs and operations, and there's no expectation of repayment. Grants are a critical source of funding in a community investment plan. I do want to highlight that grants are important because they often catalyze long-term investments or provide much-needed gap funding in a funding portfolio. So this is really broad strokes. I do want to highlight there's a lot of nuances to this. For the purposes of this community of practice, this is how we were defining community investment. Um, and then the other core concept we introduced was the role of the community health strategist. Community health strategists are the connective tissue for community coalitions. They serve as effective listeners that can identify the right partners in the community to convene the coalition. They support their leadership within the coalition while continuing to leverage public health assets so that community priorities are always at the forefront and they drive the coalition's strategies and sustainability and investment goals. And to move coalitions to action, we articulated 5 key elements of a community health strategist role. One is that connective tissue between community and multiple sectors, including its own department leadership. 2 is holding an understanding of local power structures and how to carefully navigate those structures. 3 is another key role is implementing inclusive frameworks and structures to bring community voice to the forefront of the coalition. And then 4 and 5 are really around capitalizing partner momentum to prioritize community power, community decision-making power, and also community strengths and assets. So this visual is just really, it's visual to kind of map how all these different concepts that we explored during the community of practice layer upon each other, right? So the community health strategist is supporting community leadership, shared decision-making within the collaborative infrastructure. They're also supporting the alignment of planning processes within public health, maybe across other departments. And all of this is in support or for community investment, those upstream investments in health. Finally, I'm just going to conclude with this last slide. We offered a model during the community of practice, a roadmap, if you will, practice guide for how public health can start to implement community investment model. It builds from Public Health 3.0, which called attention to the social determinants of health and a collective impact approach to achieving health equity. So similar to Public Health 3.0, Public Health 4.0, a roadmap to investment, calls for public health to invest in the social determinants of health um, through cross-sector partnership and multi-sector coalitions. And it builds or expands upon Public Health 3.0 by lifting up the role of the community health strategist. Um, it highlights the importance of community leadership. This is really central and cross-sector partnership within the coalition's infrastructure, with public health playing more of a supportive role while lifting up and championing the community's leadership to drive the coalition. The community health strategist also is also thinking about how it can leverage its department's assets in service to the coalition. So data is a key asset of public health that's invaluable to a coalition, right? It's one of public health's primary contributions. You have deep, deep, deep expertise in data. Community health planning processes like the CHIP and the CHAW are also key public health assets that the coalition can leverage to shape the coalition's strategic priorities, its strategies, and again, its investment platform. Which brings me to the fifth critical element of Public Health 4.0, which is a community health strategist. One of your key roles is to champion the collaborative's resourcing towards long-term investments in health, right? It's looking at or lifting up always the priorities residents want to see come in, the investments, the priorities and investments residents want to see in their neighborhood. Um, so it's really around driving the community's priorities around that investment platform, but also not just the development, but the implementation of that platform. And I'm going to talk a little bit more, hopefully, about that in the discussion with Shift. So that's a little bit about the community of practice and core concepts. I'm going to pass it over to Shift. Let me stop sharing.
Wonderful. Thanks so much, Anita. Really appreciate it. The overview of the community practice and some of the concepts that were discussed in that. And we're going to have a chance to dive in more specifically to some of the themes like the community health strategist, the investment platform, and really positioning multi-sector coalitions as a resource in places in a little bit. So thank you for that, and we'll come back to some details there to tease out some of the insights that surfaced during that time. I will pass it to Sonia and Lisa to introduce yourselves and to share a little bit of background around Shift.
Great. Thanks so much. Let me just share some slides here as well. All right. Excellent. So building on a lot of the themes that Anita just shared, we wanted to talk a little bit about Shift Health Accelerator's work, which we've been doing for a number of years with community partners, as well as public health and health organizations, to really think about the role of participatory governance in health funding. How do we center community voice, community expertise, and community decision-making in order to have co-design around the dollars and the other assets that flow through our health initiatives? So just a little bit of background on Shift. We are a national peer-led network. We emerged from a fellowship hosted by the Robert Wood Johnson Foundation, focused on building a culture of health. So this was a fellowship that contained a number of multidisciplinary leaders, folks who are working in food sovereignty, in housing, in arts and culture, people who are thinking about a multitude of different pathways to systems change. And in particular, with Shift, we wanted to really focus on this idea of community-led change as a pathway to accelerate health and racial justice. because we know that communities are really where a lot of solutions have laid, but not necessarily where power and dollars have been focused on or distributed. So there are three main pillars that we engage in through our work. We focus on really supporting community leaders in building the power that they need to secure all kinds of different engagements and ownership over health investments and decision-making rights and data ownership. And we'll talk through some specific examples later. We also work to hold health systems accountable around their equity commitments. We know that many of our public health and healthcare institutions are committed to health equity, racial equity, and other forms of really sort of transforming our systems. But the ways in which those commitments are in relationship to and in dialogue with communities, really sort of exploring that and thinking about different accountability mechanisms for that. And then lastly, we like to think about how we can shift the enabling conditions for those investments in community-led efforts. So what needs to change about policy, and then what needs to change at a systems level in order to really soften the ground for that work to happen. Oh no. All right. So one initiative that we wanted to talk through that we have been working on for a few years now is really thinking through how we can identify opportunities for community governance as it relates to funding. So one piece of dialogue and research that we've been engaging in is identifying the pain points that both community leaders and public health and healthcare institutions face when it comes to bridging across initiatives related to health equity. And there were a couple of pain points that our community leader peers mentioned come up for them again and again. So we know that locally developed vision and wisdom are often not prioritized. There's a lot of broken trust from previous historic harms that have taken place in these relationships with institutions. We also know that short-term transactions and sort of the engagement around projects tends to be prioritized over long-term transformational approaches. So really thinking about where there's opportunity to address those pain points directly. We've also found that for institutional leaders, so that could be leaders at public health departments, it could be leaders at other anchor type organizations within a community, some of the trends that they have found themselves in is some of these narratives around community governance being time consuming and challenging logistically, or feeling like there needs to be a business case inside of an institution needing to show outcomes and ROI in order for an initiative to have traction within their institutional setting as well. We've also heard that, oftentimes the narrative is that community partners lack capacity to engage in these more meaningful ways. And so within Shift, we've been thinking through both how we can change at a practice level what it looks like for community governance to be in place and support organizations in implementing processes that center community governance, but also thinking about some of these layers of what it takes to create institutional will and buy-in for doing this work, and then also to tackle at the sector level some of these broader narratives that really flow from histories of there being this broken trust between communities and institutions, and much of that being rooted in structural racism and other forms of oppression as well. So as we think about shifting both narrative and practice, we're interested in a few key shifts. We're thinking through what would it look like to move away from structures and decisions that are institutionally driven to those that are really grounded in community and that are both functionally participatory in the way that they are carried out, but also really leading to longer term design towards shared power and ensuring that that shared power is actually manifesting in a process. We're also looking at what it could look like to move away from traditional funding and investment models, and we'll talk about some of Shift's work in that space towards community-centered design, community-centered evaluation, really having communities define what success looks like for a particular initiative. And then, of course, overall, we're looking at how we can move away from top-down mandates and work and the ways that systemic oppression continues to show up in our healthcare system towards accountability, where communities feel like they can actually engage with healthcare institutions around their needs and their interests, as Anita was speaking about previously. And then also how we can ensure that there's ongoing dialogue for people across the public health and health sector to tap into and to design together what some of these new narratives and stories about health could be at a national level. So recently, one of the pieces of narrative work that we engaged in is we hosted a series focused on reimagining equity. This was an opportunity for us to really showcase a lot of the expertise that exists in the field and within Shift's own network of community leaders in order to talk about what are some of those spaces that we're starting from right now, particularly those of us that are doing work in the social determinants of health or people who have been engaging around health equity, but are looking for the next frontier of what that work might look like. And so there are a couple of key shifts that we examine. Some examples are, how do we move from a population health lens, which exists, in many healthcare institutions as well as public health agencies, to really thinking about centering health justice? And what are some of the tools that can aid in that shift happening? How do we think about moving from engaging community, which, obviously is a big part of how public health currently engages, to that idea of accountability? What does it look like to shift from a charity model to shared governance, and to really have there be power sharing in an active way? And then how do we think about our resources and move beyond some of the more traditional models that are often based around philanthropy or based around other forms of really sort of moving dollars in traditional ways, to this idea of community wealth building and having investments that then enable some of those more liberatory visions for health as well? So as we move along the spectrum, really honing in on clear conversations around what that looks like, having examples from the field that show that these things are possible, and then also developing tools with our network of community leaders that really speak to the shifts internally that could enable these changes over time as well. So just a few things on the horizon for us. We are currently in the process of enabling a participatory investing process that will apply many of these principles to community investment. So that body of investment dollars that Anita was also mentioning in their work. And for that, we're really interested in having first a North Star vision that starts with the perspectives of community leaders, a North Star vision that is not just about financial return, which has traditionally been the case for investment, but is really rooted in community healing and compassion. And from that vision, we are also then thinking about the tools that will be needed to actualize community governance and co-design. And how can we design those tools for a number of different audiences that are engaging in these partnerships between public health and community? We're also lifting up examples and case studies of community governance in action. So we find that one of the most useful ways of introducing this concept is to see how others are doing it and see how possible it can be, even if it's new for your institution. So really sort of focusing on that. And then thinking about some broader frameworks around deepening trust building between health systems and communities, using lessons that we learn from nature, because we think that there's a lot that the natural world can teach us about repairing some of that broken trust that has been in our public health systems for a long time. So that maybe I'll just pause and see if Jen and Lisa have anything else to share that I missed about our shift overview. Just want to make sure that we're covering everything.
Thanks, Sonia. I feel like you really encapsulated the work and the approach so well. And I would just underscore the importance of focusing on the initial relationship building and drawing on deepening trust between people who have traditionally been decision makers and community leaders who have ideas, solutions, lived experience, and a real willingness and excitement to be at the table and to have their capacity built to engage in some of these more technical discussions sometimes about financing and investment. And then also thinking through a few other things that we've learned from some of our community leaders who are in our network, just this idea of rethinking risk. I think, Anita, you spoke to it, and so did you, Sonia, and maybe we'll get to talk about it a little bit more. Just the traditional ROI model, how it may not fit. It might not be an appropriate frame for creating this new vision, this new public health 4.0 and addressing our North Star. So we've learned a lot from talking to some of our partners about that. And then last point that I know we'll get to talk to a little bit more is thinking about the best ways to identify strong investment opportunities that public health agencies, players can engage in, and what that looks like to identify the appropriate pipeline of community-led solutions that can help change health outcomes long term.
Awesome. Thank you. Yeah, I'll pass it back to you, Jen.
Great. Thank you all for the introductions to your work. And like I said, we're going to have a chance to dive into some of the specifics that are coming up in the community governance work that we're doing in Shift, the coalition work that Barhai is supporting, and some of the intersections between those. I have some questions that I'm going to put out to each of you. And if you see some opportunities to make some connections or be in dialogue with one another, we can certainly follow those threads. I wanted to just first start with this concept of participatory funding. And Sonia would love to just pull on that thread a little bit for the purposes of grounding the conversation for folks who are coming in and wanting to explore, like, what is participatory funding? So could you just give us a sort of some foundational thinking about what participatory funding is and why is it so critical in this particular moment?
Yeah, absolutely. Yeah, I was thinking, Anita, about the framework that you showed at the beginning, the Barhai framework that really talks about upstream determinants of health. And so many of us are familiar with social determinants of health, but if you go even more upstream from that, we know that power and the distribution of power, and then the ways that financial decision making happens as a result of those power imbalances are also determinants of health, because the ways that our policies and our various assets are, sort of distributed across our country really flow from the ways in which our power structures are developed. And so we really wanted to think about the ways in which an idea like participatory funding gets to that like root cause of how we think about what impacts health inequities. So we were particularly interested in this idea of where there are spaces to engage in power sharing. And particularly with public health and public health departments, we really see that function as a convener of lots of different ecosystem players, right? These are agencies and teams that are really thinking about health, not just through the lens of the healthcare system or through clinical care, but all of the other elements that make up our health and well-being in our communities. And also with the role of public health really being to bring together communities that are engaging in lots of different innovations around health and well-being, and then the clinical organizations and the other types of traditional healthcare organizations that are then interfacing with them and really thinking about that bridge opportunity. So when we think about the ways in which participatory funding can actually tackle some of the underlying concepts of structural racism, particularly as it comes to economic inequities and the ways that we know that economic inequities then exacerbate health inequities. And then there's a vicious cycle often between those things as families are trying to, access healthcare or trying to really sort of engage in health, but the limitations of the ways in which they're able to move through our economy are then causing it to be such that they're not able to thrive and not able to access well-being through those systems. We see an opportunity for participatory funding to really then give opportunity and voice to community leaders to have a say in what they think health should be in their communities, and to also have a say in not just the content or the program related to health, but in how the dollars that make up health are distributed as well. So when we talk about funding, we're really thinking about lots of different assets that are related to how health is implemented in our communities. So that could be grant making, it could be institutional budgets. So for healthcare organizations, their whole balance sheet. It could be investments. So, different types of investment capital that could be really helpful to community organizations that are looking to expand their work or looking to grow. And then there are other assets, things like land, things like, really the sort of grounding in voice and data that many community organizations bring that may not look the same as traditional mainstream evidence base. So how do we just think about, a sort of comprehensive approach to all of those things? And in terms of participatory, when you start to have processes that really center community perspective, then we can also think about the ways in which ownership and governance lead to a different way of funding flowing and a different way of investing, but also a different way of thinking through what it is that the ultimate goal of health initiatives really are. So if folks are at the funding table, if they're at the investment table, they are then driving what health means for their communities. They're able to bring their vision forward, which we know are often the visions that will have the most traction and the most impact on improving health outcomes, and then be able to see that happen. And there are a couple of examples that we're starting to see across the space. We'll talk a bit about participatory grant making, but we've seen different communities engage with healthcare institutions. It could be a community funder that's in their local area, or it could be a health system that is interested in designing a participatory process where people and organizations from the community are actually reviewing and making decisions about how dollars are distributed. We're also seeing a participatory lens start to be incorporated in investment spaces as well. So there are community investment funds across the country that are starting to pilot what it looks like for community organizations to really sort of sit in the leadership body of or have ownership over a community loan fund that then impacts the communities that they serve. Very different from a traditional model of a fund or an investment fund that sits with a bank or sits with a traditional venture capital organization, much closer to the work that people are hoping to see. So those are some examples, and we'll get into some specifics in a little bit as well, but just wanted to provide that context.
That's great. Thank you so much, Sonia. So I'm hearing a lot of opportunities to think about the tactical implications of participatory funding. So broadly taking this concept around moving decision making of particular initiatives, particular funding streams, funding strategies into community control and enabling processes to play out where community residents play a leadership role in directing both the dollars and what it's going into, but also the decision making around what does it take to move dollars and how do you deal with conflict or tensions that come up? How do you deal with funding scarcity? How do you think about broadening the lens on where dollars are situated? As Anita, you were mentioning, in coalition spaces where players might come to a coalition and have different types of resources, money that they're bringing. How do you leverage that and apply a community governance lens such that community residents are really driving the change? So I want to dig into some more specifics around how practitioners might be thinking about this work. Lisa, I want to come to you first to explore a bit around the participatory grant making fund that we at Shift led. So I want to talk a little bit about what the collaborative fund was, and what we learned in enabling a fully community-led process around a fund. What did we learn about the money flow? What did we learn about community leadership and governance? And what did we learn about trust building in that space?
Thanks, Jen. that initiative was so informative and powerful. I think certainly for me, hopefully for our whole team and for everybody who participated in it, because it took the opportunity to have direct ownership and decision making over a pool of money, a $200,000 pool of money. And it looked at that as a collective asset that was about more than just giving organizations dollars. There was a training, a deep training element to it. We had community leaders from around the country who were engaged in health writ large, public health in the broadest sense, food sovereignty, mental health work, maternal and child health work, a wide range of disciplines, who wanted to come together and be a part of what we termed our investment committee to help determine how these funds could be deployed. And they were involved in every aspect of this pilot, this test that we were running. And they learned deeply about due diligence. They got deep training on, stewardship around resources. All of these people were leaders in their own right and had been receiving grants and funding of different stripes for decades, but had never been in a position to make decisions about how to resource a community solution that was not their own. And they really determined everything about what the application would look like, what form it would come in, what the review process would look like, how decisions would be made, if who would get, not only who would be funded, but what level of funding would be applied. So there was a deep discussion about something as simple but important as, would there be level funding? Would people be each entity that was funded, would there be equal funding, or would it be equitable funding so that different organizations that were doing different types of work or had different capacities would be funded according to their own, what they were asking for in their own situations. And what we learned from it, I think, has really been foundational for our understanding of what participatory investing and participatory funding processes can be generally. The importance of community governance that starts with grounding in values and relationship building. So Jen, you asked about trust. As a team, the SHIFT team has been going through a learning process about biomimicry, where we're taking lessons from nature and applying them to social innovation and social change work. And in the biomimicry space, there's a deep grounding about the nature of trust. And I would say that in our funding example, this bubbled to the top immediately. We had to help to facilitate a space where everybody was having their voice heard, where there were rules of engagement, where there was group accountability, where there was shared language that was being built. I think one thing that can be a bit daunting at times for people who are doing deeply community-led work and have never made funding decisions before is having a little bit of a learning curve around what some of these terms are in the finance and funding world. And once it becomes a shared learning experience, it unlocks something, I think, for a lot of people, that it is not as much of a insurmountable mystery as we think, that we can all learn things together and make collective decisions for the mutual good. So there was such a powerful lesson about what it takes to build a cohort like that, and how, with enough time and intention, we did not shortcut the process. We spent a year working with the team so that the learnings could be shared, so that all decision making could be collective and consensus based. And we did have to have sometimes some challenging conversations about making determinations. For instance, if there was one applicant in our group that represented a governmental entity that was doing something very equity focused and forward thinking in their space. And so there was a deep conversation from more activist community leaders. Why should a governmental entity be funded? And so we talked about, is the emphasis here on the type of institution or the type of work and the impact that this work could have to move some levers around health and health equity. And so I think that those are the kinds of things that this type of work takes, not just the monetary control, which is very important to educate, to look at this as a literacy moment for everyone and to build some shared language and shared learnings, but also to invest deeply in the relationships and what it takes to maintain a coalition. Anita, I'm sure you could tell us a lot about that. We've all been a part of coalitions, but building in some mechanisms for getting through points of differences of opinion and thinking deeply about what you can learn, how to take those moments and fold that into the learning for the larger endeavor. And that was a really powerful lesson for us. And I will just share this. There was a point, and Jen, you might be able to reflect this back, but when we were probably more than halfway through the process, and everybody was doing the readings and learning and thinking about the structure and thinking about the health impact. And there was a moment when the decision makers on the investment committee said, "Oh, we really get to decide where this money goes." They'd never been in this situation before. They kept waiting for their opinions to be one of the considered opinions. And we said, no, this is your process and you're driving it. And so I do think what I took away from that was that those experiences are all too rare. And for us to do the type of work that we're really exploring here, we have to be willing to invest a little extra time and to remake the paradigm.
Yeah, that's great, Lisa. All of those insights were so potent as part of the collaborative fund, and I'll just underscore one point that you made, which is that the dollars actually were the least powerful piece of that experience. And while we had a fund of $200,000 in the collaborative fund to do this creative investment committee community governance work, the reflections from the investment committee members were really around agency and self-determination and what it meant to be in dialogue with other community leaders and making decisions. And so I would just offer for anyone who's curious about a participatory funding and grant making model that it doesn't actually take that much money to do a test like this. It can be a pilot of a much smaller amount where setting the container and the learning and establishing the shared language, Lisa, as you were talking about, actually might enable further dialogue and further tests of change. So the threshold on the dollar amount actually was fairly insignificant in terms of what we were testing in that space. So thank you for that. Anita, I want to bring you back into the conversation and explore some of the insights and the learning that happened in the community of practice. I have a few inquiries here, but I just wanted to start off with just to get your take on what resonated most with the leaders that participated in the community of practice. I mean, you talked about big concepts around public health leaders in a strategist role and enabling community leadership to drive multi-sector coalitions. You also talked about coalitions as an investment platform. So we want to tease some of that out, but just first, like, how did this community practice land for the leaders that participated?
Yeah, thanks. I'm also just sitting with the participatory grant making process and thinking about participatory investment and how I would love, love, love to see what that looks like in the context of a multi-sector coalition. Like I feel like that's just such a powerful form of synergy right there. So just putting that out there is like something to start with. Yeah, I will say, yeah, Jen, you called it. There was overall, I would say the community of practice, our audience for this community of practice, for this iteration, let's say, was the public health practitioners, right? These are health equity leads. They were planning community health planners. So that was the audience for this community of practice. And two things in particular resonated really strongly for the group, which was this role of a community health strategist that had a lot of momentum for the group. They liked this idea of thinking of that bridge building connector, thinking about strategies to kind of connect between and bridge build between strategies that incorporate community leadership, community ownership within the coalition, but also thinking about how do we navigate and advocate internally with our public health leadership. Like that was a strong point that resonated. I will say there was some wariness for a few of the practitioners, right? Especially the ones who do a direct service role, right? Like, how do they hold this big picture strategy role while also doing direct service? And I think for Bar High, that is the beauty of the health strategist role, right? Is you're having that direct service perspective is key to this role. You're bringing a more dynamic, really complicated understanding of community health issues into that space. What's actually needed. Um, and it's allowing public health leaders to be successful in that role. So we welcome the complexity of that. And we understand how difficult the navigation of that is, but that's how that's the offering. That's the capacity building and training that's needed, we think, um, to really be kind of, yeah, I'll just leave it at that, you know? Um, and I think that really pointed to how public health providers really need to see or be empowered to see themselves in the strategist role, right? As influencers, as change makers within their department, to advocate and champion what they're seeing on the ground or in community, right? And so this is where, like I said, the trainings really are like help to focus that capacity building. It's really not thinking just about the technical aspects, the technical tools, but it's a combination of the technical tools with the leadership development, right? Those two in combination are what's needed, we think, so that public health practitioners have the capacity to move these very complex adaptive challenges. And what we think is needed for the next generation of public health leaders and equity champions in local health jurisdictions, right? Local health departments. The second theme that really resonated for the group was this idea or this theme of aligning planning processes, specifically the chip and the chaw. For many public health leaders, they engage in many needs assessments. We all know the CHIP, the CHA, the MCAH. I'm naming off a bunch of acronyms here, but that's just like a few of the many planning processes that go on, right? And I think for Barha, we think this is a tremendous opportunity in the context of a multi-sector coalition, right? Because, like, for instance, the CHIP and the CHA often they're raising up. These are opportunities to be looking at community priorities. Their community is identifying the priorities they want to see investment in, right? And oftentimes the MCAH assessment, the other assessments, they're also doing the same thing, right? So these are oftentimes also where the social determinants of health priorities are also raised. Oftentimes I'm hearing housing as a priority that comes up. Good jobs comes up, education, quality education, childcare comes up. These are all upstream factors or drivers, and it's an opportunity for investment, right? So it encouraged the members to be considering how their department could better align these planning processes. And it's a very complex thing. We scratched the surface, but it was another area that really deeply resonated, mainly because of, right, it reduces the burden for residents. It reduces redundancy. There's an opportunity to align and resources. It's an opportunity to align on efficiency of work plans, resources. And at the biggest kind of picture, it's really an opportunity to be thinking or to build a comprehensive understanding of residents' needs, right? So, Sonia, I think you mentioned, right, we all know residents don't live their life in silos around health, that it's a very comprehensive experience of what it means to right, all think about health in terms of this comprehensive lens, right, of how do we all thrive? How do we all lead healthy lives? And so when you align these planning processes, it's an opportunity to be thinking comprehensively about health and well-being. So we wanted, I think this is an area we're going to dive into a bit more in future iterations. Um, I'll also say there were some pain points that the group raised around this, which was largely around, again, the siloed planning processes, the siloed structures, which often leads to competing timelines, departmental leadership buy-in, building in a buy-in to align these processes. I'm trying to think through some of the other there was also tensions across divisions and units around just power, right? Just internally thinking about that. So, but I think the general sense among the group was that these pain points were worth muddling through, that it was important to get through these because there's so much power in aligning planning processes. So, I think that's an area we want to dive further into in future iterations. And then I think last you asked like what's something we learned, right? And I think for Barhai, one of the things that we learned was the importance of this team approach to this work. So future iterations of the community of practice is going to bring together the public health executives, the health equity leads, the planning, community health planners, and epidemiologists into this team approach to the community of practice, to be thinking again about not just the tools to advance community investment, but also what are the leadership supports that are needed in combination with the tools to be able to work together and think through these very adaptive challenges, right? That really require the two lenses together. So that's something we're thinking about as we look to future iterations.
That's great, Anita. I love all of that and the direction that you all are going and thinking about how do you leverage different positions and positionality within health departments to activate different leadership roles and a comprehensive strategy that's both executive leadership and the program experts that are doing the work, and what does it mean for them to be in collaboration together, advancing a collective planning set of processes, investment platform. One thing that I took away from that community of practice as well is that the leaders that came into that space were thinking about their coalitions in very different ways. So some were just launching a multi-sector coalition in their communities. Others had long-standing coalitions where the public health department was serving as a backbone agency. Others where they had transferred leadership to a community-based organization to lead the multi-sector coalition. And I think one of the beauties of a community of practice was that each of the departments came in with different insights and lenses around what their coalition work meant and how it played out, as well as opportunities to say, is this working for us? And are there opportunities to more meaningfully center resident voices and leadership in the functionality of those coalitions and in the strategies that are being developed? So just to note that, because I think there were very different entry points that public health leaders came into that community of practice, and that was intentional. To say this is not a monolith, and that public health really is playing very different roles relative to community partnerships. And no matter the entry point, there's some interesting work that can be done in thinking about community governance and participatory approaches to resourcing. So that was a big takeaway for me, that there's just a lot of diversity, and that's actually a benefit to thinking about the entry point into this work. So thank you for that. Just have a couple of more questions to get into some of the nuts and bolts of like, what does this mean in practice? Sonia, very briefly, I'm wondering if you can speak to what are the things that you think need to be put into place tactically in order to test true power sharing and governance, particularly over some resourcing? What have you seen work?
Yeah. Yeah, I think there are a couple of things that are really helpful to think about, particularly when it comes to resourcing. I think the first is that oftentimes we put into silos, as Anita was talking about, even the ways that we think about funding. So grants are over here, investment capital is over here. And sometimes it can be useful to think about that as a spectrum. So when you are thinking about grants where you're not expecting, necessarily a financial return back, how do you approach that through a lens of trust? And rather than having, a number of questions and really long due diligence process, really sort of saying to community leaders, we know that you know what is needed and here are the dollars, and there will be minimal back and forth, minimal reporting. We've also seen in public contexts where you have local or state or federal dollars, the use of participatory budgeting. So, having a process in place where different community members can actually vote on the ways in which they'd like to see dollars distributed. So there's lots of models of that across the country. When it comes to investment capital, being creative about the ways in which that capital looks, how does, the sort of process around developing terms take place with communities? How might that investment capital be used to support a holistic community project like a birth center, or a facility for many different food focused organizations to come together around a community kitchen? So across that spectrum, and there can be combinations within that spectrum, really thinking through where there are different opportunities or windows to bring in that community perspective. And then one thing I'll say too is that typically when it comes to coalitions, we think about a tactical process being around a very specific project, a partnership between two or multiple organizations. There are also other levers for building community wealth and community ownership that organizations can support. So we're seeing in many community spaces the adoption of land trusts that enable people to fight gentrification, or there could be support of small businesses that are designed as cooperatives so that wealth is going back to employees, support for movement infrastructure and community organizing. So really thinking expansively about the ways that community organizing shows up. And then I think tactically what we're seeing is many of the elements that Lisa mentioned when it comes to collaborative grant making is thinking about the container, the facilitation, the ways in which we're building capacity for both community partners and institutional partners to participate, what type of infrastructure needs to be built. So how do you have a sustained body of time and process for people to come together and actually be in relationship, deep relationship with each other in order to have accountability? And then I think accounting for the planning around governance and resources, as well as accounting for the fact that there will be tensions that arise, there will be differing perspectives and different points of view, and having that be an expectation from the beginning so that there can be an actual sort of intentional holding of space for those tensions and to work through those tensions. And so that, plus I think really thinking about facilitating in a democratically decision-making oriented way, we've seen those things be really effective in these spaces as well.
That's great, Sonia. I just want to underscore this point about holding tensions. And in both the shift overview and the bar high overview, we both talked about identifying and addressing pain points and holding them. And I think it's really important to name those really explicitly so that the groups can be thinking about what is the responsibility of each individual and each organization or leader to address those tensions. I think participatory funding is not about relinquishing all responsibility to show up for, especially for public health or institutions, to really hold what is your responsibility and allow for community governance and decision making to drive investment and funding decisions. And so there's a both and there to grapple with. And I think you all have named that really explicitly, which is great. I want to tease out just a little bit, Anita, a final question for you around the multi-sector spaces as an investment platform. I'm wondering if you could talk a little bit about that and what opportunities you see in terms of multi-sector spaces really being a space for thinking about investment holistically.
Yeah. When I got this question, it was really interesting because I was thinking about kind of our times right now. It's an incredibly challenging time. I don't even think that really captures the gravity, right, of the moment we find ourselves in. And when I think about multi-sector collaboratives and public health's role and the power of multi-sector collaboratives, for a minute, I was thinking, it's a hard time for public health, right? You're dealing with gutting of Medicaid. You're dealing with major gutting of safety net programs that provide essential services to millions of people, right? What role could upstream investment play, and what is the power of these coalitions during this time? And um, I think it's a very powerful place to be thinking about it, actually. In that it might feel for some like it's the edges of learning or edges of capacity building at this place, in this time when you're like fighting for just these essentials, right? Um, but I think you know, we can ask ourselves many. So I'm asking my, sorry, I'll get to my point here, but many, including myself, right? We're asking, what does this mean for the communities we serve, right? We're taking a really, at least for me, I'll say, taking a really hard look at this moment, right? And I think it's absolutely a time to protect and defend the programs that we need, right? To protect equity related programs and policies. That's absolutely essential. And at Bar High, we've also been thinking about how do we align across sectors and strategies to sustain equity. That's a big piece of what we're trying to look at for the future. How do we build for a viable future so that all can thrive? So it's an opportunity to be aligning and sustaining, but also dreaming and building. And that's a really challenging call because what does this look like in this time, right? And as difficult as it may be, given all the threats, right? It's a think outside the box moment if you can, if you might be able to, right? Because all the standard operating procedures are just being turned inside out and upside down. So this is a moment, I think, to demonstrate the crucial role multi-sector coalition building can play in advancing resourcing or innovative resourcing strategies or investment platforms that are very creative and innovative in the community conditions for health. I think in this era of limited resources, it's going to take all sectors coming together to rethink resourcing and mutual aid. It's going to take, which is why collaboration, collaborative investment, just staying open to that planning, collaborative investment planning, opening our mind to new partners in thoughtful ways is really important. It's going to be really important now. And really shifting, I think, Sonia, you talked about this. How can partners across sectors work together to shift the narrative around resourcing from one of scarcity to one of abundance? That's going to be a really key shift. And that's something that multi-sector collaboratives, when done successfully, inherently do. It is a thinking about how are we thinking together around resources where you're not in competition with one another, but you're actually thinking about these are the resources we bring to the table. This is how we're going to collectively work on thinking of it from like an abundance perspective or lens. So multi-sector coalitions are really well positioned for this shift because in order to be successful, like I said, multi-sector coalitions must not only agree on mission and purpose, like that is important, but really partners must also align on a set of strategic priorities to move to action to be successful. And in order to move to action, there needs to be a conversation from the beginning on resourcing and sustainability that has to be inherent to the coalition. And so how are the partners pooling resources? What resources are partners bringing to the table to move the strategies community has lifted up? How are you finding opportunities to braid funding, building a co-investment strategy? How are the partners building an investment plan that includes public-private partnership? to unlock additional and non-traditional streams of funding? These are all the questions that a multi-sector coalition should be having around resourcing. And this is, again, like I said, that think outside the box moment for those conversations to be had, right? Because we are in that space, if you can, as challenging as that might be. I think a key challenge to this work is kind of what we've all been talking about, right? How do we ensure community voice and ownership continues to be embedded into these conversations around resourcing? Um, as discussions turn to resourcing, investment, the sustainability, the natural tendency is to start moving these conversations to the C-suites, the executives, right, of government, foundations, nonprofits. And that is a challenge, right? Like that's another I don't think of it as a think outside the box mode. I think of it as like it's inherently should be happening to begin with, right? Um, that the ones most impacted by the investment decisions are at the table with the C-suites and executives, right? Making those decisions, driving those decisions. So having a participatory grant making process, having participatory budgeting processes, how is community leadership in the steering committee being represented? Because that's where those decisions are being made, right? It's really important. And I think that's an inherent challenge to multi-sector coalitions that constantly needs to be lifted up. So yeah, I think that's some of the key points I want to raise. And I think just again, we're underscoring that this is a key theme of this panel, at Bar High, centering community voice and ownership in the collaborative's governance is really key to the coalition's success, because it's a form of power building. We talked about this in the community of practice. It is a form of power building. Um, Ensuring community is driving those investment decisions and the investment plan, that they're not just developing it or in the planning stage, they're at the table pitching with the investors. And I will say one more thing around that is that, to bring it back to the community of practice, our audience were public health leaders. Our message wasn't that all of a sudden public health leaders need to be investment savvy or that they need to be housers who understand affordable housing funding. No, that's not the message. The message is, again, as a community health strategist, how this is an opportunity to be that really effective listener and convener that's bringing together community championing community leaders and able to convene a table that's looking at the investment through this think outside the box moment of who are the partners that you can bring to the table, public, private, other departments. How can you bring them to the table with community, to be thinking about that investment plan?
That's great. Thank you, Anita. So much richness and the insights there around establishing investment platforms or thinking about resourcing strategies. I want to invite each of you to have any final reflections here. I will say one thread I want to pull on, Anita, what something you said was starting early in the multi-sector coalitions and just a thought prompt like, what if in your coalition spaces you might seed a conversation about what is our resourcing strategy and how might we apply an equity lens to that resourcing strategy? Embedding even that question as a thought prompt, I think will go a long way in terms of just opening up conversation about where are our resources? How do we map them? How do we understand them? Who's making decisions about them? Who could make decisions about them? So I really appreciated that sort of upfront invitation that you made. Sonia, any final insights or thoughts you would like to share?
Yeah, I'll just build on what you were saying, Jen. I think it's really important for folks to think about where there can be capture of the stories, the learnings that you're garnering from your work. Even if you're starting with something small, having some case making around that work that you're doing, even in a small way with communities, can then lead to being able to move the work forward. So I would just say thinking about how those stories can add up to broader change as well.
Great. Thanks, Sonia. Lisa, final thoughts?
I would underscore what you've offered, Anita. I feel like we've all been saying that it's really incumbent upon us, I think, to look at this moment we're in as an opportunity to take a true ecosystem approach, to look for ways to do things anew, to build a new vision, to lean into abundance as a shared goal that will require all of us to, share our power, share our wisdom, create more opportunities for others to be at the table, because it's going to take all of us.
Great. Thanks, Lisa. Anita, final thoughts?
Yeah, I just want to echo what Lisa and Sonia, Jen, you've been talking about, which is um, how to leverage these multi-sector collaboratives as opportunities to uh, there's some really exciting work happening around participatory grant making, participatory budgeting, community ownership models. There's a lot of strategies I think already out there to be lifted up in the context of a coalition, multi-sector coalition. How do we bring those stories to the forefront to then shift this narrative? Not shift, but like really think about abundance and kind of shift a culture. It's a culture shift, right? Around thinking about resourcing and how community can drive that. I think we're in a we're in a really, in that way, good place to be lifting up these incredible strategies. I feel like Shift, you all are out there doing the work with, and so it's really how can we kind of lift up these stories of impact and think about them as field building practices that are setting a new future forward lens for public health and um, I think health equity. Yeah.
Wonderful. Thank you all so much. We're excited for this conversation that will be as part of the Nature Conference, and we'll upload resources as well as some reports that we have, websites, contact information as well for anyone who wants to get in touch with us to continue the conversation. So thank you all. Really appreciate it and looking forward to continued collaboration.